Hey, my name is Melody Hackfeld, and I'm a nurse case manager at Cook Children's Medical Center. And I'm Helen Ramsbottom, and I'm a nurse case manager at Cook Children's Medical Center. And our roles are unique in regards to most hospitals will have family therapists or case managers as a part of their treatment program, but it's during the inpatient stay or PHP stay. Cook created our roles for post-discharge care, and that's why it is unique. So we follow clients after they've discharged from our inpatient or PHP program. We provide courtesy follow-up calls anywhere from 60 to 90 days. Some people are a little bit longer depending on if they need more support, but we just provide a courtesy call usually within 7 days of discharge and just check on the families to see how they're doing with transition of care from hospital to home, or if they've followed up with a different PHP program in the community. And we're there to just answer any additional questions. Sometimes there's surprise roadblocks that come up, and so we're there to help them navigate that. We give them additional resources. We also make sure that they get their medications upon discharge. With our new healthcare system, a lot of times insurance companies require what's called a prior authorization for medication. And if they don't get that, the pharmacies will not dispense the meds, or they will dispense it, but the insurance won't pay for it. And a lot of the families that we deal with aren't able to pay for the cost of their medications. So we provide prior authorizations for those medications, make sure they're taking those medications as prescribed. And then we will continue to call about every 2 to 4 weeks after that. And we're just there to provide extra support for the families. And so that's how we're very unique, because most hospitals don't do that post-discharge. So the ASQ tool it's the Ask Suicide Screening Questionnaire, which was developed and available through NIMH. Several years ago, our nurse director, Lisa Farmer-Kuntz, she noticed a trend in the increased number of children on medical units due to suicide attempts. And so she, along with the Nurse Executive Council, they got together and came up with a nurse strategic goal to address that problem. So what we did is myself, I'm in the psychiatry department, and a nurse from the emergency department, we attended the TCU EBP Fellowship Program. And for a year, we researched and gathered information on the best tool to use in our emergency department for children ages 10 and under who came in for whatever reason and have a suicide screening tool applied. So within a year of starting that program, we rolled out the ASQ. And children ages 10 and under now are assessed for suicide. Some of the impacts that we have seen with that, children have come in with a broken arm, or they have come in for asthma, a fever, and they're asked these important questions, and we've discovered that they need more assistance and more help. The thing that is just so amazing to me with the ASQ is that a group of nurses in the emergency department have embraced the ASQ and asking some really hard questions to children, asking them if they have ever done anything to harm themselves, if they're suicidal right now. Those are really hard questions to ask, and the nurses have, like I said, they have embraced that, and they are asking these children these very difficult questions. Most recently, there was a child who came in who was in a car accident, a passenger in a car, and the nurse assessed this child, bumps and bruises and things like that, but then also, asked the questions from the suicide screening tool. And this child had been actively suicidal for a while and needed help right away. And so that was something that was able to be addressed. And it's just, I can't say enough about the emergency room staff who have embraced this, and our leadership team who put this into place.